Make calls to any network with Hutch Super All-in-One. Reload and activate it today.
Hello there, very good evening and a warm welcome to the news live on Rupavahini Channel I. I'm Sharon Masquinius.
A very good evening, I am Dishan Veerakone and we start off by taking a look at your top stories for tonight.
The Buravi cyclone enters the island from Mullaitivu. A government communique says that they are ready to face any situation. The Prime Minister reiterates the need to prepare the country for development through novel strategies. The media receives scenes of the clashes at the Mahara prison. The Vadasamaga Yaligamata program to strengthen the rural economy will be implemented with effect from the 14th of this month. 487 more corona-infected persons have been fully recovered. The American-German corona vaccine is to be used in Britain from next week.
Now, a special unit of the Department of Meteorology is continuously monitoring the state of the Buravi cyclone. We now join with Deputy Director of the Disaster Management Centre, Pradeep Kodipili, to find the latest information of the cyclone.
Yeah, actually the situation is, so there are some rain being recorded in days from the Mullaitivu onwards to in many areas of Sri Lanka. And the met warning is still there, and we have prepared the ground level situations and the ground level, all the preparations been done with the Disaster Management Center and the officials and the task forces and military been standby with the equipment and all. So we got some kind of news that the landfall is there, but still not been confirmed by the Met Department. But we need to continuously contacting the Meteorological Department with the technical information. If necessary, we are going to shortly disseminating the messages to the vulnerable public communities, especially the fishermen, and all been advised not to enter the areas of around the country. And there is no any adverse situation reported so far, but we are continuously monitoring the situation with the ground level, the officials as well as the Disaster Management Center. Still, we are recommending to all the public to call 117 call center number in 3 languages. We can accommodate all the people, so with 3 languages in 24/7 basis.
Thank you, Mr. Kodipili. That was Deputy Director of the Disaster Management Centre, Mr. Pradeep Kodipili.
On to more stories now regarding the weather situation. Many areas in the island are experiencing the effects of the Buravi cyclone. The eastern and the northern provinces are facing the biggest threats. A low-pressure disturbance was created in the southeastern region of the Bay of Bengal several days ago. Later on, it has developed into a minor storm. It is scheduled to enter Sri Lanka via the eastern coast in between the areas of Batticaloa and Mullaitivu. The Buravi cyclone is blowing at a speed of 80 to 100 kilometers per hour, creating a major impact on the eastern and northern provinces of the island. The Department of Meteorology says that northern and eastern areas are already experiencing rainy weather with strong winds. The Trincomalee district is facing the biggest threat from the Buravi cyclone. The Disaster Management Centre in the Trincomalee district have relocated unprotected masses to safer locations. 237 centres in 11 divisional secretariat divisions have been placed in readiness. There is a possibility of relocating 21,820 families in these centres. All preparations have been made to provide them cooked meals. Meanwhile, 28 groups of the Emergency Response and Rescue and Relief Units of the Sri Lankan Navy have been prepared to provide relief to people expected to be affected in the Trincomalee district as well as in the north-central province. The Navy says due to the rough nature in the sea near the naval yard in Trincomalee, several measures have been taken to shift naval craft to safer areas. Spokesman of the Navy Captain Indika Silva says that the Sayura and Parakramabhahu craft have been dispatched to the Hambantota harbour. The other craft have been anchored in manner not hitting each other. The northern and eastern areas are already feeling the impact of the cyclone.
In the meantime, Minister of Disaster Management Chamal Rajapaksa says that the government is ready to face any disaster situation that could have arisen due to the Buravi cyclone. The minister, delivering a special statement in Parliament today, said that necessary funds to grant relief to the masses have been allocated. Minister of Disaster Management Chamal Rajapaksa said that the government has already set allocations amounting to 1 million rupees for the provision of essential services to the masses subjected to disasters. These funds have been forwarded to the district secretaries. More funds will be reserved if it is necessary. The district secretaries have been informed through circulars on the provision of compensation to those subjected to disasters through the intervention of the disaster relief service centres. The security service brigades established in districts subjected to anticipated disasters have been enlightened on the search and rescue missions of the three armed forces. Measures have also been taken to enlighten the officers of SSPs and ASPs and police stations on the district and divisional level. Minister Chamal Rajapaksa also said that a special program has been implemented to prevent the spread of the coronavirus in the protected centres. A program is underway to educate all stakeholders on the district level. The Disaster Management Centre will engage in a 24-hour maintenance program on the National Operational Centre and the 117 Hotline Centre. The district disaster management centres will also be operated 24 hours of the day. The minister said that these pre-planning will facilitate to direct the communities under distress to secured centres to provide relief and essential services.
It has been reported that the government is taking all necessary measures to enlighten all relevant groups in the manner to face the impending cyclone. Steps have also been taken to provide 1 million rupees of aid to each district secretary for the provision of relief to those affected by any disaster. Measures have also been taken to relocate those people living in high-risk areas to protected areas. Information has also been conveyed to those engaged in fishing and naval activities in the eastern coastal belt of the island to refrain from attending to the activities until further notice. Steps have also been taken to bring back to the shores immediately those presently engaged in fishing. The telephone number 117 of the emergency unit of the National Operational Centre of Disaster Management Centre remains open 24 hours of the day. The electricity generators have to be used for continuous maintenance of essential services in the event of a power failure due to the disaster situation. A special program is also underway to the affliction of the COVID-19 disease among people directed to protection centres. Army Commander Lieutenant General Shavendra Silva said that the Sri Lanka Army is there to protect the people of the country. He also said that he came to the location in order to assess the situation. He also said that he has inspected how the three armed forces are engaged in measures to safeguard the people.
As we predicted yesterday, the Buravi depression or cyclone is expected to cross from Mullaitivu to Batiklo towards eastern region. So we prepared all mitigation measures yesterday. We had a fruitful meeting yesterday with all stakeholders. Disaster Management Unit and District Secretariat jointly conducted the meeting. Accordingly, tri-forces, police, health department people, all people have been put on an alert stage. They have instructed their subordinates to be ready for any disaster crisis occurs.
Prime Minister Mahinda Rajapaksa says that the government is ready to accept the responsibilities and challenges to strengthen the country's economy through novel strategies. The Prime Minister made these remarks addressing via video technology the 2020 Sri Lanka Economic Forum organised by the Sri Lanka Chamber of Commerce. Prime Minister Mahinda Rajapaksa said that the objective of all activities is to continuously uplift the day-to-day lives of the people as well as the businesses of the country. He added that if it did not happen, the enterprises scattered throughout the island would be subjected to more difficulties. The ultimate outcome would have been the economic collapse of the entire country. Such a situation would have directed them to a state of not being able to repay state debt. The final outcome would have been a massive catastrophe for the country. Under such conditions, hundreds of thousands of persons would have been deprived of their employment. The overall population would have faced extreme misery due to the economic destabilization. Prime Minister Mahinda Rajapaksa further said that according to their vision, the entire country should be re-embarked on a path of economic growth. The entire country should be once again turned into a work site. He has also pointed out that the objective of a conference of this nature is to restore the country once again to a place of work. The Prime Minister further said that it is an invaluable attempt on the part of the heads of the government and the private institutions to join hands to share information pertaining to planning and strategies. He also said that one of the special lessons learned by the Sri Lanka is the COVID pandemic was that if there was an impact due to the global menace, that the people in the country should strive locally, produce their food requirements. In the past, some governments had acted with the mentality of importing any item or service. He further said that today they realize the tremendous harm caused to the country as a result of the implementation of such a policy.
Now, Defence Secretary retired Major General Kamal Gunaratne says that the chaotic situation at the Mahara prison has now been fully controlled. The national television has received TV footages of the clashes between two groups of prison inmates. These scenes have proven the fact that a fight between two groups of prisoners have escalated into a massive disturbance. The pictures clearly depicts how the inmates were behaving in a most violent manner. "106 inmates and 2 prison officers were injured in the incident at the Mahara prison. Only 28 inmates and 1 prison official are continuously receiving treatment in the hospital. 11 inmates were killed in the clash. At the meeting of the Ministerial Advisory Committee on National Security, the incident at the Mahara prison was discussed. Defence Secretary retired Major General Kamal Gunaratne said that 189 out of the 2,500 inmates at the Mahara prison have been infected with the COVID-19 disease. Measures have been taken to provide them with necessary facilities. The Defence Secretary added that nearly 100 inmates who have received bail will be subjected to PCR tests and sent to their homes. It has also been pointed out that around 21,000 medicinal tablets being used to minimize harmful effects of mental complexities have been stored in the pharmaceutical storages at the Mahara prison. The Defence Secretary further said that they are investigating into the possibilities of whether the usage of such medicine by certain inmates in place of the narcotics they were addicted to may have triggered the explosive situation. Chairman of the Advisory Committee, Minister Chamal Rajapaksa, and parliamentarians have also attended the meeting. Defense Secretary retired Major General Kamal Gunratne has also expressed opinion on the Mahara prison incident at a ceremony today. Defense Secretary retired Major General Kamal Gunratne said that the clash has taken place at a time when measures were being taken to transfer 184 prison inmates contracted with the COVID-19 disease to another location. He further said that disturbances created by one person or several others has led to a serious situation. He also said that prison officials were compelled to exert power according to the prison ordinance when the prisoners were attempted to come out of the prison. Some of the prisoners used excessive force. As a result, several prisoners were killed and many others injured. The Defense Secretary has pointed out on the calamity that could have been created if the 184 COVID-infected patients escaped and entered the society. Most of the inmates were offenders connected with drug dealings. These drug-addicted prisoners have caused the disturbances.
President Gotabaya Rajapaksa has appointed Lohan Ratwatta as the State Minister of Prison Management and Rehabilitation of Prisoners. Swearing in of the new State Minister has taken place at the President's office this morning. Lohan Ratwatta is also functioning as the State Minister of Gems and Jewellery. State Minister Lohan Ratwatta assumed duties in his new minister today. State Minister of Prison Management and Rehabilitation of Prisoners Lohan Ratwatta said that he has an understanding of the problems being confronted by the prison inmates as a person who has remained inside and outside of prisons. He also said that the present state of events has arisen due to the corona pandemic. The State Minister further said that they have discussed with the health divisions to resolve the problem. He added that all relevant measures have been made to subject all prison inmates to antigen tests. The State Minister also said that relevant documentation pertaining to the granting of 4-year pardon will have to be sent to the President. These documents will be submitted today itself. State Minister said that conditions in the prisons are appalling. The State Minister also further said that the President has given instructions to alleviate the pathetic condition inside prisons. The State Minister, upon commencing duties, was engaged in an inspection tour at the Mahara prison. He was accompanied in the tour by Commissioner of Prisons Tushara Upuldenia and Senior DIG Deshabandhu Thennakoon. State Minister Ratwatta was also engaged in a discussion with the prison inmates.
Now in more local stories, Chairman of the Presidential Task Force for Economic Revival and Elimination of Poverty, Basil Rajapaksa, says that the District Coordinating Committee chairpersons should take the initiative in seeking the participation of people on the village level on the Vedasamaga Yaligamata program. He made these remarks at a discussion with the chairpersons of District Coordinating Committees yesterday. The Vedasamaga Yaligamata program is scheduled to be implemented on the provincial levels from the 14th to the 21st of next month. During the period of the implementation of the program, attention will be focused on how to go ahead with the proposals presented on the rural level. Measures are underway to receive the opinions and suggestions of people in 14,000 villages in this connection. It has also been proposed to expand the program title Gamasamaga Pilisandarak in parallel with the Vedasamaga Yaligamata series of programs. It has also been decided to seek the assistance of groups who have not been represented and also of government officials. Chairman of the task force, Basil Rajapaksa, further said that the budget for next year has given prominence for the sectors including education, health and social welfare. It has also been planned to provide internet facilities on the rural level. He added that government has set aside a sum of around 3,000 million rupees for the advancement of distance education in rural schools. Now, a former female Tiger cadre and her husband have been arrested by the Army Military Intelligence Task Force in Paranthan, Kilinochchi while transporting a Claymore bomb. The Security Division says the couple was apprehended while carrying the bomb in a bus travelling to Kandy from Jaffna. The Security Division further says that the bomb was concealed in a package of floor mats. It weighed nearly 2 kilos. It is suspected that the bomb was transported under the direction of the international LTTE network operating from Switzerland. The arrested male and female suspects are residents of Iyakachi in Elephant Pass. It has also been revealed that the bomb was planned to be brought to a location in the eastern province. The Army Military Intelligence Task Force and the Terrorist Investigation Division are conducting further investigations.
On to the COVID-19 update now. The Health Ministry says that a total of 18,304 COVID-19 recoveries have been reported in the country at present. 487 fully recovered patients have left the hospitals today. A batch of 125 patients at COVID-19 treatment centres in Polonnaruwa district have left the centres today following their complete recovery from the disease. The recovered patients have been identified as residents from Colombo, Gampaha and Kalatura districts. A total of 352 COVID-19 patients were detected from the country today. They have been identified as close contacts of the Paliagoda COVID cluster. A total of 13,423 PCR tests were conducted yesterday. Accordingly, more than 851,486 PCR tests have been conducted in the country at present. A special discussion was conducted at the Health Ministry today regarding the treatment of patients with an anti-COVID-19 medicine invented by the Ayurvedic physician Dhammika Bandara of Kegol. Minister of Health Pavitra Vanyarachi has presided over the event. Special attention of the President Gotabaya Rajapaksa has also been focused on the drug. The Health Minister has instructed the relevant sections to conduct further research on the medicine on the state level with the assistance of other government institutions, including the Ministry of Health. The Health Minister has also pointed out that the further scientific research should be conducted with the objective of distributing the medicine throughout the country and throughout the world. She added that an appropriate set of proposals should be prepared in this regard. A committee of intellectuals headed by Professor Senaka Pilapitiya has been appointed to expeditiously formulate the relevant series of proposals. 4 COVID-19 related deaths were reported yesterday. The Director General of the Health Services says that the deaths were reported from Colombo 12, Colombo 10, Kolonnawa and Rajagiriya. Minister of Health Pavitra Vanyarachi says that the permitted will not be granted for burial of corpses of corona-infected patients, according to the Supreme Court verdict, until the receipt of a final decision of a technology committee. And taking a look at the COVID-19 update overseas now, the UK has become the first country in the world to approve the Pfizer-BioNTech coronavirus vaccine, paving the way for mass vaccination. Meanwhile, the cumulative total of confirmed COVID-19 cases worldwide surpassed 64 million, grim milestone today, with a death toll of exceeding 1.48 million at present. Britain's medicines regulator, Medicines and Healthcare Producers Regulatory Agency, has indicated that the jab, which offers up to 95% protection against COVID-19 illness, is safe to be rolled out. The first doses are already on their way to UK, with 800,000 due to the coming days, Pfizer said. The Health Secretary Matt Hancock said the NHS will contact people on jabs. Elderly people in care homes and care home staff have been placed top of the priority list, followed by over 80s and health and care staff. But since hospitals have already the facilities to store the vaccine at -70 Celsius as required, the first vaccinations are likely to take place in hospitals for care home staff, National Health Service staff and patients. The Pfizer-BioNTech jab is the fastest vaccine to go from the concept to reality, taking only 10 months to follow the same steps that normally span 10 years. The UK has already ordered 40 million doses of the jab, enough to vaccinate 20 million people. Meanwhile, the WHO's COVID-19 epidemiological report has showed that in the past week, the global case incidence remained high at about 4 million new cases. Weekly deaths, however, continue to increase, with over 69,000 new deaths reported globally. The region of the Americas was the largest contributor for the new weekly cases last week, while the European region reported a continued decrease in newly weekly cases. The United States remains the nation hit worst by the pandemic, with the world's highest caseload and death toll amounting to 18% of global deaths.
Now shifting focus to Turkey, new coronavirus restrictions came in yesterday for Turkey as the country recorded a record number of COVID deaths for the 9th day in a row.
Sites. Streets once bustling with people are now completely deserted. This is Istanbul, which has faced a number of record coronavirus deaths reported for that country. Tuesday saw 190 fatalities and 30,000 new reported cases in 24 hours, although Turkey only started reporting asymptomatic cases last week. Its government has imposed new restrictions to try and stop the spread, including a weekday curfew and full lockdowns on the weekends. Like other countries, some sectors are exempt from the measures, such as supply chains and production. The government also announced on Wednesday the extension of relief benefits available to workers. It will now last until at least June.
And to stories back at home, the chief epidemiologist Dr. Sudhat Samaravira says that treatments for COVID-19 patients are only being carried out in intermediate treatment centres and hospitals managed by the government. He made these remarks at a media briefing held today.
In the private hospitals that we know, even in the government hospitals, that we do the PCR testing or the rapid antigen testing before some procedures, especially when there is a risk of aerosol generating, like that doing an endoscopy testing, or when they are doing anesthesia, or that doing the surgery. In these instances, that it is recommended that it is good that if you check whether this person is, this patient is COVID infected or not. So earlier that we used the PCR testing, but for these instances, even in the government hospitals, that it is the rapid antigen test is using, and even in private hospital that the same thing can be done. But a person that who want to check whether he is infected or not with COVID-19 can't come to the hospital and into the private hospital and do the rapid antigen testing to rule out that. The reason is that it is not the indication, or it is not a good instance or good indication to do the rapid antigen test to detect COVID-19. There are instances that you can use rapid antigen test, that there are instances that you can't do the rapid antigen test. So because of that, only for a limited use that it is been recommended or approved to do in the private sector. If a person is that infected with COVID-19, that these people will be admitted to either an intermediate center or a hospital for the further treatment, and all these hospitals and intermediate centers are being managed by the government, and even if a patient identified detected having COVID-19 in the private sector, they will be transferred to a government facility. The only exception that has been done is in the Lanka Premier League cricket tournament. If a person is asymptomatic and found to be having COVID-19, that provision was given to treat them at the intermediate center managed by a private hospital. That is after considering all the factors and all the limitations, all the restrictions and constraints when you are conducting this type of international cricket tournament. And even if a person that who a foreign cricketer or that other visitor is having COVID-19 with the symptoms and who needs hospital care, then that patient has to admit to a government hospital. So that this how that we are managing at the moment that all the COVID-19 patients that is being detected in our country.
Well, that's a wrap of tonight's primetime news. Until we meet again next time, do take care and good night.